April from Complete Health Dentistry of Northeastern Pennsylvania. As we head into Mother's Day and the start of Women's Health Week, we are here today with Dr. Mike Rogers to discuss heart attacks and stroke in women. Dr. Rogers is one of the first dentists in the country to graduate and earn certification in the Deneen medical method. And today we have a very special guest speaker, Dr. Amy Deneen, who is the co-founder of the Deneen method. She's also an international speaker on health, wellness, and heart disease, stroke, and diabetes prevention. She is the founder and medical director of Heart Attack and Stroke Prevention Center in Spokane, Washington. She's an adjunct professor at Texas Tech Health Sciences School of Nursing, a clinical associate professor at Washington State University College of Medicine, assistant professor at University of Kentucky College of Dentistry, and co-author of the bestseller, Beat the Heart Attack Gene. Welcome, Dr. Rogers and Dr. Doneen.
Thank you, April. Hi, Amy. How are you?
Thanks, April. I'm great. Thank you so much for having me. I'm looking forward to our discussion today.
Thanks for joining us today. I'm looking at your curriculum vitae here and as a mom of three, how do you find time to jet around the country to all these locations?
Well, it's not quite as crazy as it sounds, and everything's, for a purpose. And, I have a deep passion, and it is educating individuals about heart health and what we can do as individuals, both medical providers, dental providers, and even as the medical public, to change these devastating statistics. And I have a real passion for women and heart health. I feel that there's a real reverse bias out there in medicine about women and cardiovascular health. So any opportunity, quite frankly, Mike, that I get to speak about this topic, I'm truly honored, and I want to just compliment you for placing women and our hearts first and foremost on your radio show. Thank you very much for what you do.
Well, just having known you for years now, you've instilled that with me because you've helped me give lectures on women's health as well locally in our area. And so I want to thank you for that. But what we're going to start with today is I'm just going to start rapid fire here with some questions for you and see if have you answer them and kind of educate our members of the listening audience here all in Northeastern Pennsylvania. Amy, you and Brad, Dr. Bale, co-authored an internationally profound study where the results came back saying that up to 50% of heart attacks can be caused by bacteria in the mouth. Can you give us a little bit more detail on that and how you came across that whole study and how that came about?
Sure, I'd be happy to. First, I think it's relevant that I give you a little bit of background on why my colleague, Dr. Brad Bale, and I just really delved into the idea of dentistry and heart health, and really why we feel so passionate to give dentists a platform in the world of heart attack and stroke prevention. So what happened, Mike, really it was a grassroots campaign. We were treating people as we could. We were doing, assessment on root causes, looking for cholesterol abnormalities, blood pressure abnormalities, prediabetes, genetically inherited lipid abnormalities like lipoprotein(a). Basically, we were just covering the gamut of root causes, and we were having terrific results in our clinical practices. But we were noticing there were some people that still had this residual inflammation. And our whole goal, and I know we'll get to our method later, but our whole goal is to remove inflammation in the arterial wall. And if we can do that, we can actually stabilize atherosclerosis. So it was that sort of reality that we thought, my goodness, where is this inflammation coming from? And we really do respect that in April of 2012, when the American Periodontology Society and the American Heart Association published a joint statement to say, what goes on the mouth has an association with heart health. But what they failed to prove at that point was causality. And in the world of medicine, and I believe in dentistry as well, that lack of proof of causality allows people to be a bit apathetic. It allows an opportunity for people to say, well, I think it's associated, but prove causality, and then we'll actually put it into our protocols to assess this, etc. So it was with that passion, basically, that we did a deep dive into the literature. And we really looked at all of the gram-negative pathogens that can cause periodontal disease. And we wanted to use a model, not to get too complex, but we used a model called the Atherogenic Triad, which are really three things that have to happen in order to develop plaque in the arteries. The first is cholesterol actually has to get trapped in the artery wall, which means there has to be a permeability of the lining of the artery, and there has to be an increased concentration of cholesterol. So we were able to look at the 5 dangerous high-risk periodontal pathogens, which you're an expert in treating, and show how they affect all 3 elements of that atherogenic triad, finally proving causality. And we published that paper, and it did receive a lot of attention, and we're still in a world of sort of the early adopters, people like you, people that really are into the science as well, are adapting this into their clinical practices, and we couldn't be more grateful, because we do believe strongly that all cardiovascular prevention programs must include an oral systemic component, or the patient's going to be left vulnerable.
Very, very appropriate, Amy. And thank you very much for including the oral cavity into it. We've had discussions here on our show how, you bring your pet to the veterinarian, and the first thing they do is look in the mouth to see if there's inflammation and problems there. And not that we're pets, but still, we are mammals, and it's the same thing. It is all connected. Somewhere there was a disjunction between medicine and dentistry, that you take care of that little black hole we call the oral cavity, and medicine will take care of everything else beyond that point. But now what I find is that we're all trying to bring it back together. We're all trying to work for the same common goal as keeping everybody healthy, or getting everybody healthy, and preventing all these problems.
Yeah, no, that's great. I mean, really, when you think about it, that's a terrific analogy, by the way, and something that in medicine we should really recognize, that, in medicine there's more to the mouth than just the tonsils. So recognizing that the contribution of the inflammation from the gum line and even an infected tooth could be problematic as well. So, yeah, that's a terrific analogy. Thanks.
Amy, you used the term Atherosclerosis. I'm not familiar with that. Could you explain a little more what that word means?
Oh, sure. Thank you, April. So atherosclerosis is a long word to just simply identify plaque in the wall of the artery. A lot of people think that heart attacks and strokes are due to the slow buildup of plaque in the artery. And what we have known now for decades, actually, is that plaque or cholesterol buildup and inflammation occurs in the artery wall, not through the lumen where blood flows. And what causes an event is when that plaque in the artery wall actually can rupture, and the body's natural response to that, April, is to send in a clot, thrombus, if you will. And it's that thrombus that can block the flow of blood. If it lands in the brain, we'll call it a heart attack. We'll call it a stroke. If it lands in the heart, we'll call it a heart attack. So the word atherosclerosis simply means that there's plaque in the artery wall, and we need to figure out why it's there. If we treat the why, we see the inflammation go down, and we see the plaque stabilize, which will allow people to live well. So that's the short of it, I guess.
Thank you for clearing that up. So we're here with Dr. Amy Deneen talking about women's health. And when we come back, we'll discuss the number 1 killer of women. Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number 1 focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry, transforming your health for a lifetime.
Visit us on the web at CompleteHealthDentistry of NEPA.com.
Complete Health Dentistry.
Welcome back. We're here with Dr. Mike Rogers and Dr. Amy Deneen talking about women's health.
Now, Amy, I know that you and Brad, your co-author of the book Beat the Heart Attack Gene, have developed a medical program called the Deneen method to eliminate heart attack, stroke, and diabetes, vascular problems. Can you go into a little more detail on that for us?
Sure. So the Deneen method is a published method in 2 different peer-reviewed journals that has demonstrated to identify, halt, and regress plaque in the arteries.
Wow, you can actually turn it back.
Yeah, we developed this method in a sense to challenge the standard of care, which is a risk factor paradigm. And Mike, in the standard of care, we're assessed for our risk of having a heart attack based on our risk factors. How old are we? What's our gender? Do we smoke or not? What's our cholesterol? What is our blood pressure? And based on just a few risk factors, we're told either you're fine or you're not fine. So what we did is we developed a method. It's a 9-element method that has now been proven to stabilize and prevent events and stop the growth of plaque in the arteries. Our latest publication was with Johns Hopkins. And so we do have this published method, and it's really absorbable into standard of care, into cardiology, and it welcomes and it's necessary that the dental component is part of that method.
Mm-hmm. Yeah, I've carry your book everywhere whenever I travel. It's the book that I go to read, and there's so much that I glean from it every time I read it, and it's very easy reading. That's the whole premise.
Wonderful.
that someone who doesn't have a whole world of knowledge in the medical field can certainly get a good feel for how to take care of themselves. I know.
I'm sorry to interrupt, Doctor. We keep a healthy stock of your book in our office and give that to patients that have a lot of these symptoms to help them combat their health issues.
Wonderful, thank you. Yeah, we wrote that book to the public. It's all evidence-based, of course, but we told the science through real-life patient stories because we really wanted to educate the public, to make the public advocates for their own health. So I thank you so much for sharing that with your patients. And we didn't self-publish, so it's important to know that that book really is just aimed for education of the public and the providers.
That's great. Since this is a discussion on women's health, since we're heading into, Mother's Day tomorrow, what is the number one killer of women in the U.S.?
Yeah, thanks for asking. So lo and behold, it's actually heart disease.
Is it?
Yeah, 10 times more women die of heart disease than breast cancer every single year. Matter of fact, it's the leading cause of death compared to all cancers combined. And yet, women are notoriously underassessed. Did you know, Mike, that 64% of women who die suddenly of a heart attack have no idea that they even have heart disease?
True.
And the death rate among women ages 35 to 44 has been increasing by 1.3% per year since 1997. And I think we just need to change those statistics.
Yes. Now, here, when you help me give lectures on this, I've read or I've heard or you and I have talked about that usually with men there may be an indication beforehand or they may have a heart attack and it may not be a fatal one first off. But with women it's a totally different entity or beast, so to speak, because their first heart attack could be the end, so to speak, because it's that much different. And so how do they only affect older women? Do they are there different warning signs? So if we could just go through, I'll hit you with a list of some more questions. Like, do heart attacks and stroke only affect older women?
Yeah. So going back to what you asked initially, and that was, why do women tend to present with such a fatal outcome? There's a lot of diverse reasons for that, Mike. A lot of times women tend to present later. They pacify their symptoms, if you will, until it becomes a deadly crisis. And I believe that's because of education. Secondly, our hearts are smaller, our vessels are smaller, so the assault that we can handle sometimes is less than our male counterparts. And just on the heels of that, this is an important message for the listener that I want them to know. Dr. McSweeney did a study, and she asked women, what did you feel like 1 month prior to your heart attack, and what did you feel like at the time of your heart attack? These were women, fortunately, that survived their events, and she wanted to know if their symptoms were different than men. Mike, 1 month prior to heart attacks, women complained of things like, gosh, I was tired, I wasn't sleeping well, and I felt kind of anxious. Those three symptoms are called life. I mean, so many women, as they hit perimenopause, menopause, or busy working moms do feel tired, do not sleep well, do feel anxious. And then at the time of the heart attack, the top three symptoms were not the chest pain, jaw pain, left arm pain. They were the following: shortness of breath, abdominal pain, and unexplained sweating. So what I always tell women, to the public, if you feel differently than you ever have before, consider the plausible reality that it could be your heart. And the best news you could give yourself is to go in, get checked out, and be told you're fine. A lot of women even refuse to go in because they feel like they're wasting people's time. And I just want to remove that, because if we want to change these statistics, women need to recognize that 10 times more of us are going to die of a heart attack or a stroke than cancer.
That's interesting. So what you're saying is that because of just the sheer size, the narrowness or the smallness of a woman's vascular system and heart vessels, that could preclude them or make them more susceptible to having a fatal incident.
Mm-hmm. Yeah, and there's lots of reasons for that, but that's just one example of many of why women might be particularly vulnerable.
Okay. The other thing that jumps out is, you had said that some women have stated that they could they knew something was coming, but they just assumed it was life, as you put it, that a month before they were starting to get more like an exacerbated or a worsening of these symptoms of anxiety and fatigue and inability to sleep, insomnia, say. And so that was like an elevation of that could indicate, hey, something's coming down the pike.
Yeah, definitely. And it is interesting because as we reach age of menopause, women lose their own estrogen production. It's called endogenous estrogen production. And as our estrogen levels fall, so does our good cholesterol. And the challenge with that, the good cholesterol is very protective. So there's many, many reasons why women, as they hit that menopausal age, perimenopause and menopause, have this increased vulnerability. That's just one example. But at the same time, when people are going through hormone fluctuations, they do feel tired, they do not sleep well, they do have unexplained anxiety. So the blame becomes the hormonal changes in our bodies, when in reality that may be possible, but it could be a cardiovascular crisis.
So when we come back, or right now we're talking with Dr. Amy Deneen regarding women's health. And Dr. Deneen, I'm blown away. I have my yearly physical coming up, and I know they're recommending a mammogram and a colonoscopy and a pap smear to combat or detect cancer early. When we come back, can we discuss what I can expect, or what we as women can expect from our physician to prevent heart attack, what they'll be looking for in symptoms?
I would love to. Thank you.
Okay.
Uninterrupted, unhurried attention? Time to talk about your health, your smile, and how they affect you from head to toe? If stress-free dentistry is what you are looking for, visit Dr. Michael Rogers of Complete Health Dentistry of Northeastern PA. We believe your mouth is a gateway to overall health. Complete dental health is the first line of defense against many diseases, including diabetes, heart disease, and cancer. In his state-of-the-art practice in Honesdale, Dr. Rogers offers the care you need to look and feel your best. From preventive care to implants, sleep apnea, and sedation, this is the premier dentistry you deserve. Call Dr. Rogers at 253-5000 and schedule your appointment. Just one rejuvenating visit and you'll be spoiled.
Complete Health Dentistry, transforming your health for a lifetime.
Welcome Welcome back. We're here with Dr. Amy Deneen and Dr. Mike Rogers talking about women's health.
Amy, as we ended before, I was asking or thinking, how would a woman or how does a woman know they are at increased risk for a heart attack or stroke? I mean, you describe them as red flags.
Sure. Well, a lot of women are picked up just by their own personal risk factors of cholesterol, blood pressure, prediabetes, diabetes even. But there are certain red flags, Mike, that really women should be aware of. You know, women may have an increased risk for the development of plaque in their arteries if they have things like migraines with aura in particular on their history, if they had polycystic ovarian syndrome during pregnancy, if they experienced preeclampsia during pregnancy, if they've delivered a preterm or low birth weight baby, as an example. I also like to bring in the red flags of caregivers, individuals who spend their day caring for others without paying attention to their own health. There's lots of red flags. The one big one, too, that I want to mention real briefly is any autoimmune disease, whether it be rheumatoid arthritis, systemic lupus erythematosus, psoriasis, irritable bowel. Any inflammatory condition increases our risk for vascular inflammation and the development of vascular disease. And I always educate women to just be aware of your health and understand that if we're inflamed in one body part, the vessels have a chance to be inflamed as well. Okay. And so all women that have red flags or are picked up with the standard risk factor tools should consider getting assessed for the presence of plaque in their arteries.
So, Dr. Deneen, with me going in for my yearly checkup, what should I be asking my physician?
Yeah, thanks, April. That is such a great question. And your physician at an annual physical is going to do the traditional cancer screens, which you had mentioned, which are fantastic. I have a huge respect for cancer, so I don't want to perceive like I do not. But what I want women to start asking for are non-invasive tests that are very cost-effective to look for plaque in the wall of the artery. Remember the statistic I said on the previous segment, and that was 64% of women who die of a heart attack had no idea they had plaque in their arteries to begin with. So there are two very inexpensive tests that are available. They're under $200. One is called a coronary artery calcium scan, and it's just a CT scan of the heart. You don't even have to take your shirt off to have it done. It's just a scan that they look for any calcium in the arteries of the heart. Another test, and we use it every year on our patients, is to look for plaque in the artery wall, and we use the arteries on the neck, which are so easy to get to. It's an ultrasound, not to be confused with a carotid duplex, which looks at blood flow, but we look at the artery wall for plaque. These are very inexpensive tests. We talk about them in our book, and it was recommended in 2015 and 2016 in the American Heart Association publication that we need to be asking for these tests. And even though they're not covered by insurance carriers, doesn't mean that they're not recommended to have done.
Do I have to go someplace special to have these tests done?
You might. Not everyone has the capability in their offices, but in every town, there usually is a chance to have a coronary scan done at like an imaging center or a carotid intima media thickness scan as well. So they are not that hard to get anymore. And what I want people to know is they're valid, reproducible, reliable tests that tell you if you're walking around with plaque in your arteries.
So what can women do to reduce their risk if they've gone in and had these tests and all the other things you're recommending? What can we as women do to reduce our risk of heart attack or stroke?
You know, there's so many things, April, and I think the number one hands down thing is become educated. Understand that this disease does affect us. We're not immune to it. Understand that the standard of care may not pick us up as a problem, that we might have a problem. So I really advocate that women become advocates of their own health from a cardiac standpoint. So number one is to get educated, and that is to understand, one, if you have plaque, two, what caused it to be there, and how inflamed are those arteries. Again, you treat the root cause, you reduce the inflammation, and you live a life that's long and healthy.
Okay. What else can we do?
Well, another fun one is go see the dentist often and as much as possible. You know, a lot of insurance carriers say go see the dentist twice a year, but that may or may not be appropriate for some people. Some people need to see the dentist more often and the dental hygienist. Make sure that there's no contribution of inflammation coming from the oral cavity. That is something all women can do immediately. The other thing are just move more. I like patients to exercise about 30 minutes a day. I like women to start planking about 4 minutes a day. I like women to build muscle mass so that our bones stay healthy over time. Exercise is one of the best anti-inflammatory drugs for the wall of our arteries.
Amy, can we just step back to the dental aspect of it for a second?
Sure.
Because obviously this it's me asking, but how does bacteria in our mouth or inflammation in our mouth affect our heart, affect our vasculature? Does it automatically just burrow in and cause our heart to explode? Does it cause the cholesterol to adhere more, or what does it actually do?
Well, great question. And we published an article that demonstrated the causality of the gram-negative bacteria that can live in our gum line on how it affects vascular wall health. So some of these bacteria that live in our gum line can actually cause an increased concentration of cholesterol, if you can believe it, floating in the bloodstream. Some of them can actually cause cracks in the artery wall and allow that cholesterol to get in behind that protective wall and start to build up in the artery wall. That would be called plaque. And some of the bacteria that you know how to identify and treat in the dental community can trap those cholesterol right in the artery wall and cause them to oxidize. And all of a sudden, we have a beautiful trifecta that allows plaque buildup in the artery wall. And it may be from the pathogens in the mouth. It's crazy. And so individuals going to the dentist more often, the dentist can actually check for those pathogens. The dentist knows how to treat and get rid of those pathogens, but they can't do that if you're not in their office. So I say go often.
Thank you, Amy. You know what? We're going to have Amy back next week, and we're going to go into more detail on what we can do to treat this, how we can help as dentists, and how all of the medical professions need to work together. Because to me, it sounds like, Amy, that everything that develops inflammation or creates inflammation is what's driving all of this heart attack and stroke and inflammation and problems with our hearts.
Very true.
We will see you next week or talk to you next week about this. And
thank you, Dr. Doneen. Thank you so much for spending the morning with us. And listeners, thank you for joining us. And if you have any questions or concerns, call our office, 570-253-5000. I would also like to wish all of you mothers out there a very happy Mother's Day. Remember, moms are important to us all, and if it wasn't for you, none of us would be here.
Take your health serious. Be an advocate for yourself. If you haven't seen a dentist, come on into our office. Give our office a call, 253-5000. We're here for you. We do have Dr. Doneen's book on our shelf. You can certainly pick one up in our office as well. It's very informative. Come on in and let's get you healthy.
Complete Health Dentistry, transforming your health for a lifetime.
The days are getting longer, the snow is finally melting, and now it's time for a good spring cleaning. At Complete Health Dentistry of Northeastern PA, Dr. Rogers reminds you that a professional dental cleaning is imperative to your overall health. Did you know that 8 out of 10 people have gum disease? 50% of all heart attacks are linked to gum disease, as well as stroke, diabetes, Alzheimer's, pancreatic cancer, arthritis, and pregnancy complications. At Complete Health Dentistry, you will receive many life-saving screenings to keep you in tip-top shape and decrease these potential medical complications. We want our patients to enjoy a long, healthy life with minimal medical issues. Regular dental visits will help you maintain healthy teeth and gums and help prevent serious health conditions. Take time for your health. Call 253-5000 and schedule your spring cleaning today.
Complete Health Dentistry.